Hello everyone. We are in a series that talks about the diet for patients who have blood sugar problems like diabetes or even pre-diabetes and many other health conditions like metabolic syndrome, insulin resistance, weight gain, difficulty losing that need a special emphasis on diet, on nutrition. And so we talked last two times about what constitutes a healthy diet for a patient with these issues, including the vegetables and the starches. And now we're going to talk about the protein. So let's get started. Now this is a slide of proteins. And you will notice a few things. So obviously some of the things on this page or on this picture are things that you expected to see. So meat and chicken and fish, seafood, obviously are things that come to mind. Eggs perhaps are things that come to mind when you think of protein. But there are some other things that might surprise you, like nuts, cheese, some of the starches, and some of the non-starchy vegetables. Now, remember those food items, they are not simply unidimensional. They don't just have one dimension to them. Many food items have two or more dimensions to them. A classic example for this is a lot of people will say, well, I want to have more protein, so I'll eat peanut butter. Well, peanut butter is not pure protein. In fact, peanut butter has a lot of fat and it has some carbohydrates as well. So there are three things, all three main food groups, which are the fat, the protein, and the carbohydrates, exist in peanut butter. Sure, it has protein, but it also has other things that you may not want in your diet. So you have to be careful, especially about the food items that combine several things. Another classic or another example for this are nuts. So are nuts good sources of protein? Yes, they are. They also have multiple other good vitamins and minerals, very good supplements for health, antioxidants and so on. But at the same time, they have also fat. It's a healthy fat. It's a good form of fat, but still fat that you need to be mindful of in case of somebody who is trying to also lose weight rather than only control their blood sugar. They have to also take account of the amount of fat that's present in the diet. So they cannot have unlimited amounts of nuts because that will add a lot of calories to their diet. And so on. So, those are options of protein, but the good thing is that you have a lot of options of protein. Some of them come from animal sources, but some of them come from vegetable sources that you could use even if you are pursuing a vegan diet or a vegetarian diet. You can still have protein and you should have protein. So having a vegetarian or a vegan diet is not a reason to cut back on your protein content, because protein is present in so many items that you could make use of in order to satisfy your hunger and have all the benefits of the protein that we just talked about. So more about this on the next slide. And here we find a list of high protein food items. And again, some of these things are things that you would expect to see, such as the chicken, tuna, steak, salmon, but also things that may not come to mind initially when somebody mentions protein, such as Greek yogurt, cottage cheese, mozzarella cheese, and so on. Now, other things that you have to be mindful of because we discussed them on the starchy vegetable list, such as the kidney beans, green peas, lentils, and chickpeas. Now, those have protein, but also they qualify as starches. Now, if somebody is confused, what do you mean? Should I have them? Should I not have them? As I mentioned, that when it comes to starchy vegetables, you can have an option of a starchy vegetable with your meal. It is much better and healthier for you for that option to be a kidney beans, for example, than it is for it to be white rice. Because with the kidney beans, now you're getting, as we discussed before, because it's darker and you have more fiber, less net carbs, it's going to affect your blood sugar much less. But an additional benefit is it has vitamins, it has minerals that might not be present in rice. An additional one is that it has protein. So you can also depend on it as a source of protein. It's still going to be one option of that starchy vegetable, and you need to be mindful of the quantity you consume of it, but it is far better for you to choose your starch to be a good starchy vegetable like that than it is for it to be just like white rice or pasta or bread that does not give you any of that nutritional value. And here is a list that talks about plant protein versus animal protein. There are obviously multiple other differences between the two. The animal protein tends to have more iron than the plant protein, and the amount of iron that is present in it is not only higher, but also it is more readily absorbable into the system than that you find in plant protein. Now you can use that, you know, in either way. Maybe you're trying to reduce iron in the diet. If you have a condition that makes your iron levels too high, such as hemochromatosis or whatnot, then you want to try and avoid things that are animal proteins, that are especially the red meats that have the highest content of the iron, versus somebody who has iron deficiency, for example, and they are trying to eat more foods that can raise their iron levels naturally, and then they would go more for the animal proteins, especially again the red meats. You know, but in general, this helps to remind us that you could have multiple forms of proteins, and there is no excuse for not having any protein in your diet. Because without protein, if you cut back on the amount of protein in your diet, and you know, cut back perhaps on the amount of fat also in your diet, well, then most of your calories will be coming from carbs. Remember, there are three main food items in our diet. The big food items, which we call macronutrients. Those are protein, fat, and carbohydrates. So if somebody cuts back on the protein content and cuts back on the fat content of the meal, well, guess what they are eating more of? They are eating more of carbohydrates. So if your diet is, for example, 70% carbs and 20% fat and 10% protein, well, that is unbalanced, unhealthy, and will cause a lot of trouble for you with diabetes. Why? Because the amount of carbohydrate not only raises directly the blood sugar, it makes you eat more carbohydrates. So eating carbs makes you want to eat more carbs. And the more of carbs you eat, the more you want to eat. And it becomes like a vicious cycle where you never feel full. And the way to reverse that is to eat more of the healthy fat and definitely more of the proteins. And here are, back to proteins, a lot of options that you could have, whether you are vegetarian and you want plant protein, or you are okay with eating animal protein and you choose those options. Those are an essential part of your meal. So let's regroup and see what we have learned so far. Here is a plate that has half of the plate as vegetables and 1/4 of the plate as a starch and 1/4 of the plate as protein, which here comes in the form of salmon. All right, but there are two other things that we need to discuss now. One of them is the dessert. How are you going to have a dessert? Would you need to have, if you need to have a dessert or something sweet to eat, in what form does it come and how can you consume it? And the drinks. Those are two things that we need to unpack and talk about in length, and we'll do so in the next coming slides. Let me know your thoughts and questions. Did this talk today explain to you something you didn't know about protein? What do you struggle with in your diet regarding the protein? What questions do you still have? I'd like to know your thoughts in the comment section. And until next time, where we will talk about dessert. See you then.